You're watching Canadian Muslim News on Muslim Network TV. From Toronto, Ontario, I'm Samia Sayed. Welcome to the show. Coming up later, we have an interview with Muhsin Kermalli, the Executive Director at Nasiha, about mental health during the pandemic. But first, the headlines. Affordable housing to be built for Indigenous individuals and youth. 170 Afghan human rights defenders arrive in Canada. First mosque to be built in Wolfville, Nova Scotia. Muslim genocide threats prompt court action in India. And now the details. The Minister of Housing and Diversity and Inclusion, Ahmed Hassan, announced $7.1 million for Indigenous and youth housing units in Waterloo Region, Ontario, yesterday. The federal government aid will be used for 2 affordable housing projects targeted to groups who did not have access to such housing previously. One of the 2 projects, KW Urban Native Wigwam Project, will build 14 one-bedroom units for single individuals. The second project, One Roof Youth Services, will build dozens of units for homeless, Indigenous youth, or youth with mental health needs. Around 74 units will be built in total. Sean Fraser, the Minister of Immigration, Refugees, and Citizenship, announced the arrival of 250 Afghan refugees earlier this week. The refugee group includes 170 human rights defenders who have documented human rights abuses in Afghanistan. The Canadian government is working with the United Nations Refugee Agency, among many other institutions, to identify individuals who face security risks and who need resettlement. The government has so far welcomed 6,750 Afghans as part of their commitment to resettle displaced people from the war-torn country. The northwestern town of Wolfville, Nova Scotia will be getting its first mosque. The Ummah Masjid and Community Center in Halifax is building the new mosque in Wolfville and stated that the project is long overdue for the increasing Muslim population in the area. The new mosque will be built next to a highway and can be accessed by residents in 3 surrounding towns. It will also be close to Acadia University, with the upper levels of the mosque dedicated to student housing. 3 Supreme Court justices in India are launching an investigation into threats by some Hindu extremists against the Muslim minority in the northern state of Uttarakhand. The announcement comes after Anjana Prakash, a retired Supreme Court justice, filed a petition. The organizer of a Hindu religious parliament last month offered to pay millions of Indian rupees to recruit Hindu suicide bombers, while another leader said to kill 2 million Indian Muslims. The speakers used the 2017 Burmese genocide of Rohingya Muslims as an example to follow when dealing with Indian Muslims. Indian Prime Minister Narendra Modi is being criticized for not speaking out against the call for genocide against Muslims. That's it for the headlines. For our interview today, we have with us Nasiha, a mental health hotline that answers calls 7 days a week for Muslims and non-Muslims alike. They also provide counseling services and conduct community workshops. I would also like to extend a trigger warning to anyone who has trouble listening to discussions around mental health, or to call a healthcare provider if needed. With us from Nasiha is Executive Director Mosque Kermalli. Welcome, Muhsin. It's great to have you here today.
Thank you very much. Assalamu alaikum to everyone.
So it's your first time on our show. I want to ask if you could tell us how Nasiha was founded.
Yeah, absolutely. So Naseeha was actually founded in 2006 by a few members of the community who saw a rising need amongst youth specifically who were suffering from different issues. And the idea was to create a helpline at that time. Since then, we are now a registered charity here in Canada as of 2016, 2017. And alhamdulillah, just before the pandemic, we are now a registered charity in the United States in the year 2019 and 2020. And since inception, obviously the charity and the helpline has grown exponentially since 2006.
Mm-hmm. And I gave a brief introduction about Nasiha. Could you go over some services that Nasiha provides?
Absolutely. So the 3 main services or areas that Nasiha focuses is, our priority is the helpline. Alhamdulillah, since the inception, we are now a helpline and a text line. So basically that's that number that you see on the screen, the 1866 Nasiha number, can be accessed 12 hours a day, 7 days a week, and it's again a helpline and a text line. So that's our priority.
Mhm.
This year, we have been able to successfully launch to the public a free web therapy program, which allows individuals and families who need support or more in-depth therapy support to be able to access therapy via online platform free
Mhm.
of charge, which is accessible from just registering online. And the
Mhm.
third area that Nasiha is heavily focused in around is around providing educational workshops and webinars. And the idea behind our education and outreach service is to be able to not only educate our community but to also raise awareness around mental health and mental illnesses, and then to break the stigma that's associated within our community at large. So
Mhm.
those are the three areas that Nasiha, our core services focus around.
Mhm. And who is answering these phone calls or requests?
Yeah. So on the when we started with quite a few volunteers, and as the evolution of Naseeha has evolved over the years, we now have trained volunteers who are paid, who are in the field of mental health. Some have designations such as psychotherapy designations or MSW designations, or are on their way to become professionals by having degrees in those related fields.
Mhm. And this is all confidential, correct?
Yeah, so our four mandates are obviously having a confidential, anonymous, non-judgmental, barrier-free access for people so that they have a safe environment to be able to talk about the issues that they're going through.
Okay. Now, during the pandemic, we saw that there were a lot of reports released where there were increased levels of depression and anxiety among the people. Now, almost on year 2 of the pandemic, has that changed?
So I think before the pandemic, I think it's important to realize that mental health within not only our community but the greater society at large was trending higher and higher. Right, we've seen that cases of depression and anxiety, as you allude to, were already on the increase. Right, with the pandemic, that has exacerbated that whole issue or those issues furthermore, and we definitely have seen an increase in our call volume as well as our text volume over the past 24 months,
Mhm.
significantly to the point where we're seeing a call volume increase of almost three times of where we were pre-pandemic.
And I'll pick up on that call volume once more, but I'd first like to ask, has the pandemic changed the way in which Nasiha offers its services?
Yeah, absolutely. I think that before the pandemic, we were gearing up to do more on-site and delivery of our services in person when it comes down to especially our outreach and educational services. Under the helpline, we've been able to, so to say, tech up, and we have a lot of our counselors working remotely, which is great. So we've been able to increase our not only our staff on the helpline, but also our volunteers. But from an educational outreach perspective, we've had to turn into a lot of virtual seminars, virtual workshops that we do not only within community and messages, but we also focus on the greater general public and work with local school boards as well, both in Canada and in the United States.
Mhm. It's great to see Nasiha has adapted so well to the virtual platform. Now, I want to pick up on something that Nasiha recently posted on Twitter, that there was a mental health crisis in Quebec. What is this crisis that Nasiha is referring to?
So, unfortunately, with the rise in Islamophobia across North America and the world, here in Canada specifically, recently we've seen the tragic event that unfolded in London in 2021, along with this Bill 21 that has come about in Quebec, which those two events, along with other events, has significantly caused more unease and anxiety for Muslims, but also other minorities. So, what we ended up seeing is a significant rise from callers, specifically in the Quebec region, and many of them citing these issues around Islamophobia, which then result into more isolation and fear and anxiety, which causes them, a lot more stress and depression and anxiety, so that they're looking for more services to be able to help them, right? So we
Mhm.
we definitely thought that it's prudent to be able to let the general public know about what's going on, and based on our data and our stats, that it is something that is quite alarming to us. And to note that the ripple effect of that is going to be continuous for the foreseeable future as well.
Mm-hmm. And so I want to go into this term that you use, the word crisis. It sounds like it's an emergency term, something that's impending immediately. And so why did you choose the word crisis to explain everything, especially given that mental health has been a concern that has been rising during the pandemic already?
So I think that if we don't consistently look at issues, like obviously we have issues such as a vaccine support, which is a crisis, which we need vaccines, for example. In other areas that we look at food and shelter as crisis areas where we need to support. Mental health is something that, as a result of what we're seeing from our stats and our data, and also the rise in, for example, suicide cases, even amongst Muslims, it being almost double the amount of the general populace.
Mm-hmm.
We need to start really looking and sounding the alarm bells so that we can actually, hopefully, inshallah, get ahead of this curve and start waking up and start educating ourselves around mental health, mental illness, and what we can do as individuals and as communities. And obviously, inshallah, hoping that Nasiha can continue to deliver our service and grow to meet that demand, inshallah.
Mm-hmm. Now, we've also seen during the pandemic that a common response to someone expressing feelings of depression or anxiety is to compare yourself to others to see that you're in a better position somehow. And so how does Naseeha break down or bypass these cultural or even general misconceptions around mental health?
So I think, around, we all come from different cultures, and I think we're stigmatized a little bit differently when it comes down to mental health. So I think education is one of the key aspects or areas that we feel that we need to continuously deliver on content. So in today's world, a youth of today's world who was born and raised in North America would have a very different view on mental health, anxiety, stresses than their parents and maybe a generation prior. So we see a very big gap in that so-called knowledge of mental health and mental illness, and with that gap comes biases, right, that our parents or even sometimes our own siblings have towards mental health. So it's important that we educate ourselves, we raise the awareness level of mental health and mental illnesses, and try to understand better what that means, and then obviously leverage and use services that are out there. And alhamdulillah, we have many services in our community that are available, not only for Muslims but others as well, who should be taking advantage of calling in, gaining that education level, and then if they need that therapy, they can actually take on and inshallah, hopefully get the therapy that they need to solve or to help them through whatever struggles that they're going through.
Mm-hmm. Well, unfortunately, that's all the time we have for today. Thank you so much, Brother Muhsin, for joining us to talk about this issue of mental health. It was great to have you here.
We really appreciate it. Inshallah, we hope that we all have a happy new year, and 2022 sees a lot of good change, inshallah, around mental health and mental wellness, inshallah.
Inshallah. You are watching Canadian Muslim News on Muslim Network TV. That's it from our Toronto studios tonight. Make sure to like and subscribe to our channel for more Canadian Muslim content. We have also included Nasiha's hotline number down in the description box. That's it for tonight. See you next time.